Hi, Mark Fullweiler again, and this is my fifth video in the series of leukemia testimony. And this one, oddly enough, is on my aversion to drugs. I don't know if anybody watching the video has an attitude like myself, but I just don't like to take drugs unnecessarily, for headaches, for, this or that. Um, but when it comes to leukemia and the kind of radical treatments, uh, chemotherapy, bone marrow biopsies, spinal taps, all this, um, you will be much better off just to resign yourself to take the recommended drugs from the physician. And I can say the only time that I got sick to my stomach, where I experienced nausea, was when I refused to take the drugs to, keep myself from getting sick. And I was going to wait until, I actually needed them, and then I'd, ring the nurse and have her come in and give them to me. That's too late. So the only time I got sick was when I was being obstinate and refused to take them. And after that, just routinely when they suggested, recommended that I, take some anti-nausea drugs, I just took them. And I can say with the 4 different doses that I took of chemotherapy from beginning to end, I only got sick that one time. And that was because I refused to take the drugs. Now, that's just me. But I was able to down the chemotherapy like it was Kool-Aid. It didn't affect me at all. And that made for a much more pleasant experience all the way through. If being, in the hospital, all that can be pleasant at all, uh, the absence of being sick to my stomach helped a lot. Where I knew that there were some other patients who just suffered terribly with nausea, but I didn't. And the same thing goes for when they were doing bone marrow biopsies and such. I just told them, give me as much drugs, painkillers as you see fit. There's no sense in experiencing pain. And I found that once the pain came on, it was hard to manage it. But if I took the drugs prior, it wasn't a bad thing. And I know initially, because when you are in this state of, taking all these drugs, and fever is a very dangerous symptom, they don't want to give you any drugs that mask fever. So instead of just taking, some aspirin or something for not feeling good, they will prescribe to you Class C drugs like morphine, Oxycontin, which I just thought, this is mind numbing. I just have a little pain, and you want to give me morphine? But the dose that they gave me was like 5 milligram. They assured me you're not going to get addicted. If you need it, there's no worry, and you will find that it'll make the whole procedure and the hospital stay much more comfortable, and your recovery, chances are, faster if you're not also having to battle pain. So, once again, I just submitted myself to the advice of the physicians, and when they would recommend taking, painkillers prior to a procedure or something, I would just do it. No argument, I would just do it. And went through the whole thing really without any nausea or pain. Uh, it wasn't that bad because the physicians do know what they're doing. And so if there's anyone out there that's, thinking they're going to John Wayne themselves through this, be a man, tough it out, I can guarantee you this will kick your butt unless you take these medications. Um, this is much bigger than just having a headache or an achy muscle or something from working in the yard. These drugs, I would say, are necessary for your recovery. So um, just settle it in your heart that there's no worry taking these narcotics, morphine, Oxycontin. This is what's available, and it's very effective. and there's really nothing to worry about. So anyway, follow the doctor's orders and you'll do fine. Thanks a lot. Have a great day. Bye-bye.